Well, good afternoon and welcome to everybody to the virtual Compassion in Action Healthcare Conference. I am Dr. Beth Lamb, the Chief Medical Officer at the Schwartz Center for Compassionate Healthcare. On behalf of all of us at the Schwartz Center, we are very happy that you've joined us for today's session. So please join me in welcoming our wonderful presenters for this workshop. Dr. Reverend Krista Gregory, who is the founder of the Center for Resiliency at Dell Children's Medical Center. And joining Krista is Phoebe Long, research scientist at the Center for Resiliency at Dell Children's Medical Center as well. So Krista and Phoebe, we're so happy to have you and looking forward to this workshop. Thank you.
Thank you, Beth. It's so great to be back with all of you all. It's been strange being virtual with folks. I enjoyed being in Boston last September, and many of you came to our workshop last year. So if you are coming back, thank you very much for coming back. I hope this will be a great experience for you too. But at least we can do this and connect, and this is special to us. So thank you for being here. So let me tell you a little bit about me, and then Phoebe's going to introduce herself. And I'll tell you a little bit about our center, and then we're going to have an experiential hour together and give you some actual tools you can use to replicate in your center immediately following this workshop, because that's what we're known for, is being super practical. So again, my name is Krista Gregory. I've been in healthcare about 30 years, long time. That makes me feel very old. I come from a chaplain background, so I'm a board certified chaplain with the Association of Professional Chaplains. But I left the bedside about 4 years ago to start the Center for Resiliency at Dell Children's Medical Center in Austin, Texas. And I've been here at this facility now for 10 years, but I left that role to be in doing this work. And that just means I get to do a deep dive in this work 24/7. I mean, this is what I do. I look at how we care for our staff, how we live this work in a way that allows us to, our tagline is healing people, staying human, because we want people to be able to stay human in the midst of this work and have lives and have families and have joy and really love the commitment they made to this profession. So that's what we're about. When we started this several years ago, we started immediately doing research with Dr. Kristen Neff at University of Texas at Austin, and her research partner, Dr. Chris Germer at Harvard Med School. And we're looking at their process of mindful self-compassion and how we could transform it into something specific for healthcare. So you'll hear some of that today, but it was at that time that Dr. Phoebe Long joined me. At that time, she was a researcher at UT, but now joined our staff about a year ago this week. And now we have a team of Dr. Phoebe Long, myself, and Cassie Kopecki, an admin assistant. So the Center for Resiliency, if you'll go to the next slide, Phoebe, was philanthropically funded at first by a fabulous donor outside of Austin that believed in what we were doing. And the hospital also was obviously supportive for us to create this, but the hospital has since joined that philanthropic donor and expanded our staff to 3. We look to further donations and further expansion in this next year as we've added consultants, we've added other researchers, and so it's pretty exciting. But we've been very evidence-based from the get-go in what we're doing. And as I said, we're with Dell Children's in Austin, which is a part of the larger national network of Ascension. So that's where we sit, and that's what we're about. And Phoebe, why don't you introduce yourself?
Hi, everybody. It's so good to be with you today. My name is Phoebe. I have a PhD in educational psychology from the University of Texas. I've been working with Krista for the last 4 years, working to evaluate various self-compassion-based interventions for healthcare workers, and have been really pleased to team up with her and to be able to both offer training that has seemed to be really effective for helping people manage the difficult emotions that arise when they're working with people in the healthcare system, and also to make sure that the interventions we offer are actually useful and that we're not wasting our time. So I'll be presenting some of the research we've been doing later on at the end of the workshop.
Thanks, Phoebe. And so what have we been doing since March 19th or ish in Texas? we have been doing something called virtual resiliency rounds. Many of you have implemented various things for your communities through the experience of COVID, and so have we. And that wasn't it wasn't a hard pivot for us because we were doing these kind of things locally already, but we went in the virtual realm like all of the rest of us in this moment. So we opened up our work outside of our facility at first to people in our region, but then we opened it up across the country. We've done research on this virtual resiliency rounds model, and Phoebe's going to present that at the end of our hour together, towards the end of our hour, about 12:40. So you're going to see the research out of it. The research is pretty incredible, and why it was effective is fascinating. But in order to make this meaningful to you, besides just gaining information about research, because we could all read that in a paper, we wanted to give you an experience of this. So we're going to invite you to experience it as if you'd come to one of our virtual resiliency rounds in Austin, Texas. And we're going to leave time at the end so you can ask questions about the process, so you can hear, as we said, about the research, why it was effective, why we think what we've seen through our study, and then share any materials you want to have that you could replicate in your institution. So that's the invite today. So I hope you're ready to play, because that's what we tell people. We want you to play with us. So let's just imagine you're at your center, you're in your hospital, you may be at home right now, but just imagine you're doing the work. We have bedside personnel that join us. We have administrative people that join us. It's across the board. So we want you to have an experience too that might be beneficial to you, but that you can see as a model to do yourself. So, all right. Well, so we're going to transition. Phoebe, turn the slides off. This is what we would do. Look at everybody's faces. Take as many people as we can on video. So I hope you'll stay on video if you can. I won't judge your background. And then we try to inject as much energy into this experience as we possibly can. Hello, everybody. So welcome to Virtual Resiliency Rounds, Coping with COVID. We're really glad you're here. It's great to see everybody today. I don't know about you, but I really needed this. There are times when I get so frustrated with my own family, and I'm dealing with what we're dealing with in the middle of wearing my mask at the hospital and all the things that we're doing, that I need to just be with people that get it. I just need to be with people that understand, and I don't have to explain it. So I'm really glad you came today and that we're gathered here together today. So, my name's Krista. I'm gonna introduce myself just like I would if I were leading this. And I'm at the Center for Resiliency in Austin at Dell Children's. This is Dr. Phoebe Long to my left, our research scientist. Just so you can be reassured, she and I will be teaching this together, but we've studied everything we give you because we know you have this much time, and so do we. And so we want it to be effective for you. We want you to know that it isn't something we just think is a nice idea, but it's actually something we've been able to show has been effective for other people like you. So today, let me tell you a little bit about this process, especially if you're first joining us for virtual resiliency rounds. If you're new to us, just know that we've been doing this now since the beginning of COVID. So it's not new for us. These virtual resiliency rounds that we took online, like we have had people from across the country join us. And we want to give you, we're going to be talking some things about what we're dealing with COVID, but we're also going to be, it's not just a support session. It ain't therapy. What it is, we're going to give you some practical tools that you can use at the bedside while you're working. How about that? While you're putting on your PPE, while you're standing in the ante room, trying to figure out how to do this and stay grounded. We're going to give you some stuff you can use in the moment. Because for us, at this point, it's not just about getting home and trying to de-escalate. It's really about coping with what we have on this. So we want to start out by saying who's on the call. So if you're on this call and you have access to chat, I hope you do, I'd like you to put your name in the chat, your name, your city, what hospital you're from, maybe even your role if you want to. Just don't give us much more than that or we can't read everybody's. But your name, what city you're in, and what hospital you're from. And let us know what that looks like. And we'll see, we've got Angela, who's a chaplain in LA, Mary Inglis, Monica Kraft in Oklahoma City. We got folks from Seattle and California and Dana-Farber, yay. I see some folks I know from there. Children's Hospital Dallas, hey, Leslie, Judy, Chicago, Betsy from Durham, North Carolina. This is kind of fun, yeah? I know. Pretty cool, it's flying pretty fast. San Diego, Center for Ethics, University of Minnesota. And if we could add up all of our states, I wonder how many we'd have. We'd have up to 50. It's pretty cool to see who's with you. And just as you look at the chat yourself, just be reminded, yeah, I know. It feels sometimes like you're the only one in your own city or your own state that's the worst on the list for COVID, but Unfortunately, we're all kind of in the same boat together. And sometimes looking at that chat is just kind of a good reminder that you do got people across the country that get it. And maybe even across the world. I haven't noticed if there have been any that popped up from other parts of the world. Yep, Toronto, Canada. Hey, Mary. Yeah, unfortunately, we're all in the same thing. So thanks for joining us. So what is virtual resilience? Come together in the community. We don't let patients and families join us. Did I get unmuted? Yeah, there we go. We don't let patients and families join us because they're having another experience. This is us. We'll give you some tools today that you can use to regulate your nervous system because we're a little in the hyper zone with that right now, understandably so. I'm not sure why I keep muting. There we go. Okay. We're going to have a chance to dialogue about our experiences, and we're going to listen to each other. Something that we need a lot of times right now. A couple of ground rules you need to know. We will share names like you just did in the chat. But if you didn't want to do that and remain anonymous, that is okay too. We're glad you're here and we welcome you here regardless. The private link is only available, like I said, to us, so don't share it with anyone outside of healthcare. We need safe spaces to connect about what this is really like and tell the things that aren't being told on the news. Because the goal is to provide tools for managing stress and our nervous systems, we won't really discuss politics, concerns, or things about organizational things around the country or organizational things in our particular healthcare system. We will listen to each other compassionately. There is no need to compare ourselves to each other. We're just going to be a source of support. And we'll take comments at the end of the call. Usually at the end of these calls, we have an after party. We'll have our after party a little different with you guys, but normally we have an after party at the end where people can stay on and ask more questions or talk privately if they'd like to. Well, we're going to start. So if you want to stand up, I invite you to stand up where you are. So if people are in your space with you, they're like, what the heck is she doing? Or what is he doing? But stand up. I think my earphones will reach. Yep. If you don't want to stand, you can sit. It works both ways. But I want you to stand. We usually start with sort of a grounding practice. Something you can use quick, on the fly. We call this finding your anchor. So when you begin to feel a little overwhelmed, we're going to talk about empathetic resonance in a little bit and about later on in this morning. But when you get to kind of, you're feeling a little, nervous system's a little hyper, maybe you're absorbing the anxiety of all the people around you. This is a great practice you can use called finding your anchor to bring awareness to the present moment. Because we can jump to the future, which is completely unknown. We can go to the past, but we kind of need to be here. So your anchor can be anything. It could be the soles of your feet. It can be your breath. It could be a sound. We've even been playing in research about sounds in the hospital, like that we hear that go on around us. But today we're going to work with our feet. So I want you to feel the soles of your feet on the floor. You can take your shoes off or not. It doesn't really matter. Just feel your feet on the floor. Rock back and forth, side to side. Just kind of get in your feet. You're getting out of your head. You don't need to take notes. Just get in your feet. You might make circles with your knees. If you're arthritic, maybe be a little more careful with that, but like I am. But make some circles with your knees. Yep. When you notice your mind wandering, just feel the soles of your feet again. Yeah, pretty simple. Seems too simple, I promise, but it works. You can try walking slowly if you don't want to walk away from your computer like I can't with my headphones. I'm going to walk in place, just kind of noticing the change in sensations in the soles of my feet. Yeah. I'm bringing attention all the way down from my head. I'm getting out of my head because sometimes in this, that is not a good place to be. I need to go as far away from what's in my head and the anxiety of that, or the frustration, or the stress, or the anger. The farthest place I can get from that physically is the bottom of my feet. So get out of your head, bring your attention all the way to the soles of your feet. There you go. Now you can sit back down, take a deep breath, come back and join us, readjust your screen. The next time you feel overwhelmed or frustrated, or maybe you're dealing with a difficult family, maybe you're putting on your PPE and you're like, really, people, I need to get in that room 5 minutes ago. Get in your feet. get out of your head, and it will remind you, whether it's your feet or your breath or another sensation, it gets you grounded in the present moment. It's a simple tool. It seems like it's ridiculously simple, but it works. I have taught people to use this in rooms with very anxious families so they don't get sucked in the vortex of the parent's anxiety or the patient's anxiety. They can go like, I'm just gonna get in my feet. And no one has to even know I'm doing it. It's a great practice. It's not like I have to go meditate in the bathroom. I can do it while I'm talking to you. And you don't even know I'm doing it. So it's a great practice to use anytime, any place. And I invite you to be reflective about that and when you might use it. All right, Phoebe, it's all you. Tossing it to you.
Okay, great, Krista. Thank you so much. That was so helpful. So we're going to be talking for the next few minutes about compassion and empathy in the time of COVID, which I think is a really relevant topic right now. There's a lot going on in the news as well as in our cities and in our organizations. And a lot of us are feeling really overwhelmed by just kind of the suffering that people are experiencing right now. And so I'll talk for just a moment about the difference between compassion and empathy, and then Krista's going to lead us through a really lovely practice called compassion with equanimity. So as human beings, we all have the capacity to feel what each other are feeling just by looking at each other. So we can feel positive emotions when we see someone experiencing joy, and we can also feel negative emotions when we watch other people experience anxiety. And so just like COVID-19, emotions are contagious. And this skill is really useful as humans. Being able to read each other quickly allows us to cooperate in groups, and it allows us as healthcare providers to provide aid to each other when we're struggling. So I thought I'd just ask you all, and you feel free to write in the chat, is where we'll put our answers to this question. Can you think of a time recently when you caught another person's emotions? So this might be an example of a time you were feeling pretty good and then you interacted with someone who was anxious or angry and you started to feel the same way. Or maybe you were feeling kind of bad and someone else's expression of joy started to lift you up. So you can just write in the chat an experience, maybe a recent experience of a time when you caught another person's emotions. Stephanie is saying, friends, joy and overwhelm from a brand new baby. Yeah, absolutely. Empathizing with both of those emotions of extreme joy and extreme overwhelm. That's a lovely example. When my kids laugh at bedtime, that's great. Oftentimes in support sessions, we hear stories of loss, which can definitely be felt. Kathy's saying, someone helping me with a music recording. I was excited about it, but the other person seemed annoyed. Okay, so feeling excited, but then kind of catching that person's feeling of annoyance. Margaret says, anxiety of starting school again. Yeah, so these are all wonderful examples of how we can kind of catch each other's both positive emotions like joy and each other's more difficult emotions like anxiety. So I think as healthcare professionals, we are often surrounded by people experiencing various levels of difficulty and suffering. Patients with COVID, for example, or other illnesses, or even our coworkers who are anxious about catching the virus or bringing it home to our families. Many of us tend to feel exhausted from not only experiencing our own difficult emotions, but also of witnessing others experiencing these emotions as well. And so while you may have heard of compassion fatigue, neuroimaging studies support the idea that the exhaustion we experience when we resonate with other people's difficult emotions is actually more accurately described as empathy fatigue. And this was demonstrated in one study by Klemecki in 2013, where they showed a group of participants a video of people in distressing situations. And they looked at what happened to their brains when these people were watching other people experiencing distress. And what they found was that the observers, the parts of their brain associated with negative emotions lit up. And then later, the same group of people was trained in compassion exercises of offering loving kindness to both themselves and to other people. And they did these practices for about a day. They watched the same distressing video, and this time a part of their brain associated with positive emotions such as love and connection lit up as they were watching the distressing video. So these results are one reason to believe that when we're feeling exhausted emotionally from resonating with others' suffering, we actually need more compassion for ourselves and for others rather than less of it to feel more sustained. So in other words, while empathy can be thought of as resonating with others' emotions, compassion refers to wishing for or acting towards the alleviation of another's suffering, which helps to maintain a distinction between self and other and also helps to cultivate more positive emotions. And I think sometimes in contrast to offering more compassion to ourselves and others, what we tend to do when we're dealing with working with others in pain is that we sometimes try to cope by putting up a wall or a barrier between ourselves and others. And it's so that it just might feel easier or safer not to feel anything at all than to feel really overwhelmed on a daily basis. I think Roshi Joan Halifax actually gave a wonderful talk at this conference a couple of months ago. And I loved what she said about how we need to relate empathetically with others, but in a balanced way. She said, a world without empathy is a world where we are dead to each other, but also in a world where we are always vicariously suffering, we can be really overwhelmed. So we need to maintain our capacity to be in resonance with other people, but also to see clearly, I am not that person in pain. So this practice that we'll lead you through will help you to offer compassion to yourself and another person who may be experiencing difficulty for a variety of reasons. And an really important part of this practice involves equanimity, which is the ability to see the larger picture regarding your ability to solve someone else's problems. So equanimity has been described as the protector of compassion. It provides us a more spacious perspective so that we can maintain a caring connection with others without feeling overwhelmed by their pain. So the following practice, compassion with equanimity, is designed to increase our capacity for compassion. And Krista, I'll turn it over to you.
First of all, I love what you guys you're answering each other in the chat, and that's what we like, because that's how we get to know each other and get to connect and realize I'm not the only one that feels this way. I saw Wendy write, yeah, me too. Or Nina wrote, yeah, same Wendy, thanks for sharing. So we're gonna take you through give you another tool. And then after this, we're gonna have a breakout session where you can talk about what we've talked about so far. And then you're gonna talk about what this practice is like for you. So this practice comes from the work of Drs. Krista Neff and Chris Germer, but it's been adapted for healthcare professionals a little bit. And we use it a lot, and I've used it a lot in COVID. And people have found this to be one of the most helpful ones that they've experienced. And we'll put some of the phrases in the chat in just a little bit. Okay, Phoebes, I'm just letting you know that. But right now I'd like to invite you to just get comfortable in your seat. You can sit or lay down or whatever you want to do, but most of us are sitting. Just get comfortable. Take a few deep breaths, just kind of settle in your body. You might want to offer yourself a supportive gesture, like bringing kindness to your experience. Like you might put your hand over your heart, just feel your heart rate, be aware of it. Just kind of notice your physiology. Yeah. Because I'm going to ask you to do something. You can close your eyes if you want to, and eye closing is just simply so you can focus on what you're thinking about and not be distracted by what you see. There's nothing otherwise magical about that, so do what you feel comfortable with. But I want you to bring to mind someone in your professional life, maybe at the hospital, or it could be your personal life, maybe you're at home a lot, that's exhausting you or frustrating you. And this person is someone that you care about. But maybe that person is in a lot of pain. And I want you to clearly imagine this person and the situation you're in. It could be the last COVID patient you took care of. It could be your boss that's telling you to change your PPE one more time to a different method. I don't know. Someone who's exhausting you or frustrating you, who's struggling. And maybe you start to feel a response in your body as you're thinking about this. I'm sorry about that, but as you're thinking about this, I want you to notice, do you feel your body tensing up a little bit? Maybe your shoulders are crawling up some. Maybe you feel some anxiety, some aversion to even thinking about this. Yeah, just notice your body. Your body usually talks as well. We always don't pay attention to it, but I want you to listen to the following words as I say them, as you keep thinking about this situation. Everyone is on their own life journey. I am not the cause of this person's suffering, nor is it entirely within my power to make it go away, even if I wish I could. Moments like this are difficult to bear. Yet I may still try to help if I can. Now, noticing the sensations and the emotions you're experiencing right now, begin to breathe a little more deeply. And start focusing for this next few moments on your inhalation. And don't worry, we'll give you those words later. Don't worry about writing them down. Just imagine, just breathe in. Imagine you're filling your whole body with compassion as you breathe in, because you're going to need it. You do need it in this moment of difficulty. Breathe in compassion for yourself and feel soothed by giving yourself some compassion. And then as you exhale, you can begin to send compassion out to that person that was suffering or that was causing you pain, or maybe that person who was causing you frustration. Sometimes it's hard to send compassion to that person, but it's okay. Just do what you can. Don't stress yourself out if you can't do that, but just try to think about sending compassion towards them. And continue to breathe in compassion for yourself and out for the other person. Letting your body kind of breathe itself. Allowing your body to breathe naturally too. And as you do this, you might say, one for me and one for you. In for me and out for you. If you find someone who needs some extra compassion, you might try blowing some compassion their way. Or if you're really struggling and you're like, this is so hard, it might be 10 breaths for me and one tiny one for you. It can be big or little. It doesn't have to be even. Or maybe it's one for me and two for you. And if it's hard to send compassion to the other person, like I said, just take a moment to focus on yourself. Filling your own cup with compassion first, and then offering some to the other person. And then you're sort of can scan your body and just notice any tightness or discomfort. And send compassion in towards those places as you inhale. Into those tight shoulders, or that jaw, or that tight throat. Imagine compassion going there. Oh yeah. And then sending compassion out as you exhale. You're allowing your body to be caressed by the breath as though you were floating on waves in an ocean. Limitless waves. And it can hold all suffering, including your own. Now I want you to listen to these words again. Everyone is on their own life journey. I am not the cause of this person's suffering, nor is it entirely within my power to make it go away, even if I wish I could. Moments like this are difficult to bear, yet I may still try to help if I can. I want you to notice the effects of the practice on your body and on your mind, and now letting go and allowing yourself to just be as you are and opening your eyes if they were closed. Yeah. All right. I'm looking at the pictures I see. You're looking a little more calm. I'm going to send you into a breakout group of groups of 4. I think they're going to take care of that for us, and we'll see you back in about 5 minutes. Just talk about that experience for you, debrief it, kind of think about what you felt during the practice, what it was like, what was challenging, what you didn't like, if you had trouble coming up with stuff, but just talk about it with each other for a little bit. It helps to have that connection with somebody else. So I invite you to do that. Thanks, Melissa and Jen, for taking care of the breakouts, and we'll see you back here at 12:35. There we go. Hopefully everybody's coming back now. Yes. So can you imagine using that practice in COVID? And if you can unmute yourself or you can type in the chat, but tell us how you think you might use that in COVID. Anybody want to tell me, how would you use that with COVID in this time of COVID in particular? The person I was talking with was talking about using with parents. So I invite you to write in the chat how that might have been for you. Seems a good way to end a huddle. Yep, Stephanie says that. Yeah, because we do huddle. We like take on all their stuff, we do. I mean, even if we don't want to. And you're just like, that's right. This is their journey. This is their stuff. This is their experience. Trying to use it for frustrations among colleagues. Yeah, that's why we added that part about you can pick someone you're frustrated with. Yeah, I'm going to give you a couple examples in a minute about how we do with that. I've used it with the MDs and other providers during COVID to help them find self-compassion. We do it during staff support. Good. Yeah, I'm doing COVID care groups for our staff and you'll use it there. Good. Yes. Yes. Very good. Yeah, so I was working with a nurse who was working with a COVID patient and while we had plenty of PPE, we didn't have enough people to take care of all the patients we had. I know you guys have had those same situations where you are. And it was really, really hard. She was a baby nurse. She'd been a nurse for about 9 months and she was in a very difficult situation. And we did this together and she was using it for a patient that wasn't getting any better. The patient was on his own life journey. I did not cause this person's suffering, nor is it entirely within my power to make it go away, even if I wish I could. And then family members who aren't taking COVID seriously, I don't know, anybody have that experience? Yeah, right? Oh my God, they're on their own life journey without a mask and without the stuff. Okay, I did not cause them to be crazy, nor is it entirely within my power to make them wear a mask. Moments like this are difficult. Yep, they are. And I'm still trying. So, you can use it in all kinds of ways. You can do it as the hospital's on its own life journey. They can't figure out how to do PPE correctly and they're on their own journey with that. And I'm going to do my own thing as I try to work in the midst of that. There's lots of ways to distinguish yourself so that you don't end up getting caught in the vortex of the anxiety of other people. It's very interesting. And we've used it for outside of COVID, we use it with the difficult physician who might be angry. Wow, they're on their own life journey today, aren't they? I mean, it's a corny phrase and it may sound a little corny and that makes it sort of fun, but you can use it in a lot of different ways. Phoebe's going to put the phrasing in the chat so you can have the phrasing. You already did. Fantastic. You can also use it for COVID. COVID's on its own life journey, right? We don't know when it's going to be over. I didn't create it and I didn't create the policies that limit our healthy response. Nor is it entirely within my power to make it go away, even if I wish I could. Moments like this are difficult to bear. Remember, because that reminds us that I suffer too. Compassion with equanimity, compassion going both ways. And I'll still try to help as I can. So it really is a great balancing tool and we've used it in a lot of circumstances. So what is it like to listen to the equanimity phrase, everyone's on their own life journey? Equanimity allows us to look at the bigger picture when we're struggling. It's difficult to experience compassion when we're distressed with another person's difficulty. And then you can use pieces of the phrase. Sometimes I used to use one piece of it and it's enough to kind of settle me. We've also used it when a surgeon, like I said, surgeon was angry or dissatisfied with a surgery or procedure and is berating the other healthcare members. They look at each other and go, breathe in compassion for all of it. And they look at each other, they kind of do this. And then they breathe a little bit out. But it reminds them of community. It reminds them of connection. It reminds them that they're in this together and it takes that off. When an administrator is asking for something that doesn't look like, so when the struggle to adhere to prescribed metrics, I had a healthcare administrator say, the metrics are on their own life journey. I am not the cause of this outcome completely, nor is it entirely within my power to make it go away. So when I was telling Kathy, who's in my breakout room, we've used it with parents of with kids with chronic illness, but we changed the phrasing just a little bit, which we can share at another time. But and then, yeah. So, and the last one, when patients or parents are facing a socioeconomic challenge, sometimes they come to us and they want us to take care of everything. They just do. And I get it. And you're holding all of that and you feel so responsible and you go home at the end of the day and you said, That asthma medication really didn't change anything. They need a new car, a new family, a new house, and a safety place to live. And so it's so frustrating and hard. They're on their own life journey. I didn't cause this poverty. Maybe I did in a bigger sense, but in this moment, nor did I cause this circumstance. Moments like they're difficult because I want to fix it all for them. And I'm going to still try to help. So it allows you to have compassion and still help and not be so overwhelmed by the need that you see. So lots of ways to use it, but it's really important in COVID. So we would wind it up. We would have some more connection. The groups would be a little bit smaller, so we would have talked some more in the chat and unmuted. But we would say thanks so much for coming, and we'd say goodbye to you, and we'd see you next month. So that's how we do this. We were doing these 3 times a week at first, then 2 times a week, then once a month, then back to once every week. Kind of has varied during COVID because of the surges that we've had in Austin and in Texas. We've brought it up, brought it back, but it's just a pop in, learn practical stuff, connect, see other people's faces, and you feel better about that in the end. And we usually talk very currently about what is happening. If there's been a surge in our area, we might mention that. If everybody's, thought healthcare workers were heroes and now they think healthcare workers are villains because they want you to wear a mask, we talk about that because that's real and on people's minds. So that's how virtual resiliency rounds goes. And then we would hang out for an after party for people to talk to us after that. I'm going to turn it back over to Phoebe. She's going to show you the research we did on this and what happened with that. And then just the research we've done in general around some of these practices and what we're finding.
Yeah, so just to answer a couple of questions are coming up in the chat, and we'll have time also at the end of our session to answer questions. But just so we don't forget, people are asking about how long are your groups. Typically they're about an hour, but we've also done half-hour sessions for people who only have that amount of time for lunch. How do you advertise these sessions? We have an amazing creative coordinator who makes beautiful flyers that we email to our various distribution lists. Right now we have a database of about 2,000 people that we send out the information to. And then we also have people who are kind of our regular group that are on a Google Calendar invite. And then we haven't provided night sessions, Krista, but we can talk a little bit more about timing at the end. So many good questions. I'm going to just talk briefly about the research so that then we can get into your really awesome questions about how to implement this way of providing support. So I'm going to share my screen. We have a couple more slides. I think the research is pretty important to getting buy-in from people, and it's one way that we're able to advertise as well, to say that these are kind of the results that people are experiencing. Just to double check, you can all see my screen? Yes, okay, perfect. So we've been able to do one research study on the people who attended our virtual resiliency rounds. What we did was very simply, we asked them how anxious they were feeling right before the virtual resiliency round and right after the virtual resiliency round. And we found that overall, 97% of people who attended did experience a decrease in anxiety from before to after the rounds. And I think this is a really cool thing to share with people who've just experienced our practices, because perhaps you can relate to this feeling of increased calmness. People overall also averaged a 40% decrease in anxiety. So pretty large decreases in anxiety as a result of attending our resiliency rounds. We asked them also to provide open-ended feedback about what they found helpful and what they thought could be improved about the sessions. And a number of themes kind of showed up. One theme was that they felt like it was a signal, just offering support, a signal from their organization that they value our humanness in this. And we know how important it is to not only work at the individual level to build resiliency, but also to work at the organizational level, and organizations kind of signaling support for our workers to take care of themselves. They spoke specifically about practices that we taught. We teach sometimes a soothing touch practice, which comes from the mindful self-compassion curriculum. the reminder I needed for healing, the healing power of touch, even if it's just me soothing myself. And then someone else said, hearing that I'm not the only one going through the same situation, I felt supported because we all can relate to each other. So not only the teaching of the grounding practices, but the ability to come together in community and share similar experiences was really helpful. And then this last person, I think, summed up overall the combination of both learning practical tools that they can use and implement in their lives, as well as coming together in a group setting. I really felt like my worries were heard and echoed by a group of people, and then I therefore felt less alone. I left the meeting ready to utilize some of these strategies and try to take better care of myself this week. So we were really pleased that people found these strategies useful. We also have had the majority of people tell us that the sessions are very helpful. Fewer people have said they're somewhat helpful. Nobody has said that they're not helpful at all, so that's really good. And then transitioning a little bit, we've published this year a study that occurred before COVID happened on a 6-week intervention we created with Dr. Kristen Neff called the Self-Compassion Program for Healthcare Communities. And this is a 6-week intervention. It's a 1 hour a week session for 6 weeks where we provide really practical tools that people can use to implement in their day-to-day work life that is based on mindfulness and self-compassion. And we found in these studies significant increases in self-compassion among our participants. We had a comparison group, so we saw throughout the time that we did the study no significant changes in our comparison group. But in our intervention group, we did see significant increases in self-compassion, compassion satisfaction, which is a measure of how satisfied you are in your role as a caregiver, and then really significant decreases in stress. So that was a pretty large effect size there. You can see that number going down quite a bit. And this was a result of these people attending our training. We did another study where we were able to replicate these results, and we saw significant increases in self-compassion, mindfulness, compassion to others, and compassion satisfaction as well, and then also significant decreases in stress, again, in burnout, in secondary traumatic stress, and other measures of burnout, such as emotional exhaustion and depersonalization. So I think these were really exciting findings before COVID happened, right? Burnout was a really big problem in healthcare even before the global pandemic. Now though, during COVID, we really were interested in seeing how our interventions would be utilized and potentially effective for the people attending our training. So because we were already doing so much research already, we had one study in the works, and we had collected data before COVID happened. Because nurses often work 12-hour shifts and can't attend a 6-week-long intervention, we provided them a 1-day workshop in January. And we collected data 2 weeks before the intervention, 2 weeks after the intervention, and then we did some follow-up data collection 3 months later, which was when, was in May, which was when the pandemic was going on. So we saw significant increases in self-compassion in the group, significant increases in compassion satisfaction. I think it's interesting to note that the increases that our intervention participants saw after attending the training were maintained throughout the pandemic, suggesting perhaps the skills were useful for dealing with some of the difficulties folks were experiencing. Mindfulness was significantly increased, and compassion was increased as well. We did have a comparison group, so we tracked a similar cohort of nurses throughout the 4-month period. The comparison group levels did not change, so this suggests to us that the increases we saw in our intervention group were potentially actually due to attending the training rather than the events that were occurring in the world. In this study, we also saw significant decreases in stress and significant decreases in burnout. And then one last study I'll share with you is because of COVID, we weren't able to meet in line. So we were able to transition all of our trainings to an online format. And we were curious to see if people would be affected similarly by attending the intervention online versus in person. We continue to see significant decreases in burnout, secondary traumatic stress. We also saw differences in depression and stress from pre to post intervention. So signs that this intervention is potentially helping people with the burnout and kind of difficult emotions that are emerging as a result of the pandemic. We also saw significant increases in self-compassion. We have not seen significant increases in compassion satisfaction, or a measure of resiliency. We'll be collecting post-test data, follow-up post-test data in September. So we'll see if those increase, but that's kind of an interesting finding that perhaps compassion doesn't increase in an online training as much as it does in an in-person training. And with that, we have plenty of time for questions. So we would love to interact more with you all and hear the questions you have. I will stop sharing so that we can see your faces. Great.
Yeah, and I'm going to share my screen and I'll show you a flyer that we had that we were using during COVID. So let me do that real quick. There we go. Did that show up?
Yeah, that looks good.
Yeah, so let me just slide my screen up. So there we go. So yeah, this was a 30-minute ones we were doing, 30-minute resiliency rounds. We created, obviously we had QR codes so they could just hook in on their phone and it took them straight to Zoom, and then, or they could click on there. So it was really practical tools to cope with stress and anxiety and give you a chance to connect with others facing similar challenges. That's really the goal of virtual resiliency rounds. And like I said, it could be adjusted in real time, which was really effective. Like if there was something going on in the city that moment, if there was something going on in our hospital at that moment, that virtual resiliency rounds could go there and address that in that experience. So, but yeah, so it's pretty simple, but our great creative person put that up. I'll quit sharing so we can see you.
Yeah, I see a question about, are the groups usually cohorted by discipline, or do you do multidisciplinary groups? And for the most part, they are multidisciplinary, but we do offer, for example, we're offering our residents the trainings in their particular cohorts, and we've worked with various departments specifically as well.
It's been, honestly, it's been cool to have it multidisciplinary during COVID, because we've had school health nurses talk to outpatient physicians who are, it's a weird community building moment for all of us. And I found the multidisciplinary actually more helpful. And then everybody's leveled. It's like Schwartz rounds. Everybody's leveled at like in Schwartz rounds, we don't operate out of these hierarchical roles. We're just like, it's hard for me too. My mom's acting weird also. And that helps to create community, and it helps create community at the bedside. So same model that we have together with the Schwartz Center. And a limited number of people per session. No, in the beginning when we were starting out, we'd have like 3, or then we'd have like 70. I mean, we've had up to like 70 on these before. I do one group that says about 75 as a community clinic, and they all come on and they love it. And it's 30 minutes. So I think you get more people if you go shorter. The hour long we're averaging right now about a screen's worth of like 15 people, 20 people sometimes. Yeah, the larger the group, the less interaction you might have. That's why breakouts are so important. That's why we did it with y'all today. But y'all are finding that, I'm sure, as well in your virtual experiences. But if it's a small group, we're just unmuting everybody and we're just talking. But yeah, they're averaging about 10 to 15, 20, it depends on the day. But then we've had groups up to about 70. We do other events that have like 350, so we've had bigger groups for other things, but not for virtual rounds. And we have people, the thing, nurses love it because they can do it on their day off and they can do it on their phone. They're on their phone. They're not having to come up anywhere. You know that with virtual, that's been the advantage. So our night shift folks, we've done them at 4 o'clock and 7 o'clock and 8 o'clock and 12 o'clock. So we do them at different times that accommodate night shift folks as well. But we don't do them in the middle of the night. I'm not super effective in the middle of the night. And so most people that have come in for night shift usually will come in right before. Volunteer facilitators. Do we have volunteer facilitators? No. Phoebe and I do it.
It's all us, yeah.
It's all us, because it gives us a stable expectation for people. They know they're going to get us. They know they're going to get the same kind of deal, and I think that's been helpful. And since we're virtual, you can get bigger or smaller, and it doesn't matter.
Krista, there's another question about reaching out to those who are more skeptical about self-care. Did you see that?
Yeah, I think that's why the practical thing is really important. You got to give them a tool. You got to give them something that works. Like, yeah, who have been your main partners to be able to reach out to the healthcare workers who might be part of it? I mean, I've been at the bedside for all this time, so they know me and they've vetted it that way. And so that helps. If you have someone completely from the outside stepping in going, let's all have this time together, people are going to be a little skeptical of you. But if you keep it, it's got to stay in healthcare language, and it's got to stay, I'm going to give you something to help you out with this. Okay. Yeah, please do that, because putting on PPE in that room by myself and going in there by myself really stinks, and I need something. So you keep it in that frame, not in a sense of a support session. You say support session, most people are going to say, I don't have time for that. But you give them something practical, they come back for that. So you obviously were doing support. You felt supported, hopefully, but we don't market it that way. Oh yeah, we have a lot of tools we use. We're going to have a teacher training for that sometime in the future. Phoebe, you want to address that? We do not record sessions because sometimes people share pretty privately in those sessions. So we have not been recording them because we don't want them to have fear that it's not a safe space.
Yeah,
but we have had night people on the shifts, on the sessions.
Yeah, Kevin, that question about how could we learn about additional practical tools to use, that I feel like that could be a whole nother hour. If we have a lot. Yeah, you're welcome to email us. We'll have our website up soon. We have a lot of comics that our creative coordinator has created for people to give them kind of a really quick taste of what these practical tools are. But I would just encourage you to think of, if you do practice mindfulness or you do practice self-compassion, to think of how you might be able to translate those kind of longer meditations into something that people can do in their day-to-day work situation. So soles of the feet is a really great option. Walking, which can be used, walking around a patient's bed, walking from one room to the next, really anytime. And I wish I could share all of the tools we use with you, but I think there's a little too much.
And our website is up. I'm just going to send you the website link. There you go. It just got up like Friday. So it's up, there's stuff there. You're welcome to reach out to us. This is what we do. This is what we do. And it's always practical. It's always in the moment. If you can't use it while you're on your shift, then we don't teach it, honestly, because that's really what people are asking for and need. That's what I needed. If I can't learn how to regulate my nervous system while I'm doing this really challenging work of healthcare, and then afterwards it works for their lives. So
I think we're at time. Thank you. Yeah.
Thank you all.
Well, I'm sorry to end it. I mean, I feel badly, but thank you so much. I just really want to thank you both, Krista and Phoebe. It was just terrific. And we appreciate your time. We appreciate everybody's time today and sharing your experiences, sharing all your info, and the website, maybe again, if you want to put that into the chat, that would be great. And we also want to thank our national business members today. We're really grateful for their support. Thanks to the audience. Keep an eye out for a recap of the week sessions, and also look for an email to claim your continuing ed credit if you want to put in for that. We're going to take a little break around the Labor Day holiday, so we'll look forward to having you guys back on Friday, September 11th. And the session then is Wounded Healers, Reflected Writing, Personal Resilience in a Culture of Compassion. It's a workshop with Dr. Maureen Mayhew, who's a physician, practicing physician, clinical professor at the University of British Columbia in Canada. So thank you again. Wonderful session, and have a good weekend and week. Take care, everybody.
Thanks, everybody. This was fun. It's great to see you.
It was fun.